Hi everyone, welcome to this video. My name is Melina Messing. I'm the scientific director of Ren-Nu, which is our nutrition and lifestyle program for people with PKD. And today is my great pleasure to be joined by Christopher, who is also a PKD patient, and he has some really exciting data to share with all of us. Christopher has undergone some lifestyle changes in the last year, and it's been really paying off. So I'm super excited to share his story here today. Welcome, Christopher.
Thank you so much once again for having me.
So do you want to maybe start off with just briefly recapping what you've been doing over the last year or so and why we're talking here today?
Absolutely. And once again, I just want to say thank you so much to yourself, Dr. Wimes, and every single thing that you guys do, especially in the PKD community. I really do feel that this treatment saved my life. But a little bit of a backstory is that I pretty much had a utter fire lit in my life, went in for a MRI in May 2024 for unrelated kidney issues. It was actually to look at a liver cyst. Got a phone call the next day from my doctor saying, hey, my kidneys have grown massively from a ultrasound July 2023. Kidneys have nearly grown. One of them grew by over 15%. The other one was close to 20%. In such a short time frame of a 10-month span. Was doing a lot of research and ultimately found you all and your program. For the first couple months was pretty much like really in the blue. I knew that I had to cut out all the feel-good type foods, which was causing a lot of problems, especially for if you have polycystic kidney disease. Feel-good foods, pretty much sodas, a lot of beer, a lot of pasta, anything grains related, starchy veggies, potatoes. And during those 2.5 months window, I pretty much was doing kind of like a cheat day in a way and stuff. Not to mention, I wasn't at the time incorporating KetoCitra into my daily lifestyle at all. It wasn't really until beginning of August when I actually said, hey, I got to hit the ground running here, and pretty much made a full-blown commitment. From August up until December, pretty much just did a straight ketogenic standard diet. Cut out the starchy veggies, potatoes, grains, like I said, desserts. I did not have any cheat days whatsoever. 4.5 months of straight ketosis, and I pretty much got handed something better than what I asked for. Pretty much was hoping and praying for just slowing down the growth, and my ultrasound in December showed a full-blown halt, which was mind-blown because it had been 7 months for my MRI, but just by completely gutting out everything and all the sugar that I was consuming, didn't even realize how much sugar I actually was consuming. Hundreds and hundreds of grams, which I highly encourage anyone with this condition, please take a moment, add up all the sugar that you consume on a daily basis, and ask yourself if you're consuming sugar on an empty stomach. I was doing that in the morning. I was buying organic bread, organic jam, organic yogurt, but sugar is sugar, unfortunately. So please, definitely, if you are looking to make this go on this healing journey, look at all the sugar that you're consuming and see if you can start eliminating a lot of them. And in the beginning, it's going to be extremely hard. I ended up failing significantly for the first 2.5 months. But after December, I pretty much moved deeper into a more deeper level of ketosis, which is more so ketovore in a way. Pretty much became a little more restrictive, lowered my carbs even more. Just a very straight kind of red meat heavy, not full-blown carnivore, just more red meat heavy. And you're kind of really lowering your carbs even lower, not really focusing on like net carbs, just focusing on a solid 20 to 30 total carbs per day. And from January up until April, pretty much did that for a solid 4 months, no cheat meals. And I got a shock of a lifetime from the MRI data, which is beautifully mapped here. Thank you so much, Dr. Messing, for mapping all this data that I've got in the last year. And now in the last give or take 5 months per se, I've actually been doing carnivore, zero total carb. Wanted to give that a shot. Basically try every avenue that really revolves around ketosis, because you can pretty much do ketosis in many different forms. And still waiting on some confirmation from images, but all this data here is pretty much my journey from the last year and a half now.
Yeah, so shall we dive a little bit deeper into what's actually shown here? I know it's been on the screen for a while, but let's actually go into the results. So on the left-hand side in the left column is just the background that you just gave a great introduction to. So I'll dive right into the graphs that are shown on the screen. All right. So first of all, what I also want to commend you for is not just your incredible discipline and determination to do this process, but also your data tracking, because that's really what is educating you about your own body, right, and your own response. And it's so important to have data to be able to know if it's working. Are you in ketosis? Is your blood sugar coming down? That kind of thing. And this is what's shown in these first 4 graphs here. So the very first one is kind of your best indicator of whether or not you're doing it right, which are your blood ketones. And the aim is always to be above 0.5 millimolar. And pretty much since you started this process, with just a few exceptions here, you were above that line that we're always going for, which we think is the therapeutic range of ketosis. Even sometimes you go really high, and I think that's to do with some of your fasts that you've been doing. Yep. But in a really great range, and you can see you've been really consistently sticking to being in ketosis. So that's wonderful to see that it was working for you and that it is actually feasible to do it over many months like you've been doing it. And then your blood glucose here is also very stable in a very healthy range during that time. It's exactly what you would expect to see when you're in ketosis, but also it's just a great confirmation to see. This is just the glucose ketone ratio calculated based on these two graphs, basically. And the lower the value, the more it's like an indicator of metabolic health, and you are very metabolically healthy according to this index. And then your fasting as well. You were always fasting. You recorded your daily hours for fasting. Sometimes you fasted for multiple days. That's why we see many dots here at the 24-hour mark. But your average was always around 14 to 15 hours. So consistently also intermittent fasting throughout this whole process. So already this shows, this is kind of the proof that you were really sticking to it. The numbers don't lie, right? So you're really were able to be in sustained nutritional ketosis this is about a 9 months period. So good for you. Congrats on that success, first of all.
Thank you. I do have something to add about the blood ketone level. So this is something that I've learned, and a lot of people I've seen get very discouraged. Your ketones are based on your metabolical system and the way your body really processes them. My body, because I'm very lean. I don't really produce a lot of ketones anymore. Also because I've been in a thing called fat adapted period, where my body is so used to using ketones now, where as soon as my body makes them, I just use them. And I've done a lot of testing with this, where I've woken up, taken my ketone levels, gone to the gym in a fasting state, worked out, and my ketones have actually dropped, meaning my body is using them, which is what you really want. Whatever range that you get for your ketones, that's your ketones. I have family members they're on a weight loss journey. So their ketone levels are insanely much higher than mine because I've been without a cheat meal now for about nearly 11 months and no complaints. I love what I eat and I love what I do. My ketones normal range is so low from fasting. It's, or rather, let me say this. I just did a 24-hour fast a little over a week ago. At the end of the 24-hour fast, I was at like 0.6. That is barely above 0.5, but if you've been doing this for a while, your ketones, but it can be different for other people. Some people they can do this for many years and their ketones go up. These ranges for my ketone levels are primarily my body. I just don't want anyone to get discouraged because you do see people online saying, "Hey, I have a higher level of ketones. You know, is this different or something? Is this better?" But other ways, I've removed all the very bad things that was contributing massive blood sugar and high insulin levels.
Yeah, and it's not just ketones play a big role, right? But it's also like you were saying, what else is going on in your body? You being in ketosis, your glucose is lower, your insulin response is normalized, and then also we should mention that you've been taking KetoCitra consistently, so you also have exogenous ketones are still entering the system as well. So that also supports, even if your own body doesn't generate those extra ketones or you can't measure them, those exogenous ketones from KetoCitra. And then also the other protective elements that KetoCitra brings are also very important. So yeah, it's definitely a system thing, not just a one parameter will tell you the whole story. Yeah. So shall we go to the most interesting part, which is your awesome MRI data?
Absolutely.
All right. So here, well, actually not starting with the MRI, we're starting with the ultrasound. And like you were saying in the introduction, between 2023 and 2024, you saw a pretty drastic increase or normal increase for PKD. I would say that's kind of the standard growth, especially for PKD1, which is your variant. And that's kind of what one could expect, what many people see as a growth in 1 year. And then you recently got your measurement again in 2025 after the intervention. And really awesome to see is that the kidney length just measured by ultrasound seems to be reduced. Now, that's ultrasound, and many people will say that could be inaccurate. And that's totally true. So we also, of course, looked at your MRI data. So that's shown here in B and C. And in B, it's actually measured with a semi-automated tool where there's still a little bit of manual measuring. It's called 3D slicers. If anyone ever wants to analyze their own MRI data, that's available for free. And this was done blinded by someone who didn't know anything about this story. And they found that in 2024, the total kidney volume was larger compared to 2025. And then I also analyzed this data with a fully automated AI-based tool that's fairly new online, also available for free, called TraceOrg. Great tool, really loving it. And there too, this fully automated tool found that the total kidney volume declined from 2024 to 2025. This tool generates some error bars, so you do see there's still some overlap. Keep in mind, this was a 9-month intervention, so even seeing no growth at all is already a huge win, right? And this even indicates that there is a shrinkage as well, which is phenomenal to see. And it's not what any PKD patient usually sees when they go into the clinic, right? When you talk to nephrologists and you say, is there ever shrinkage over the years? The consistent answer is no. So seeing this is very, very encouraging. And I'm, as a PKD patient myself, I'm very encouraged to see this. And then also looking at your liver, you also have liver cysts. We also measured the total liver volume, and there too seems to be either a stabilization or even decline in liver volume. which is awesome. Also, given that you had a pretty significant growth between 2023 and 2024 just by changing your lifestyle and being super dedicated to this intervention, really shows you how much control you actually could have over the progression of this disease, which is something that PKD patients have never heard before, that we have any control over what happens to us, right? But this is real data showing that you do have the control. And here are just some example images of what this automated tool generates, the type of MRI image analysis that comes out of this AI-based tool. So do you want to add anything to this?
So you're the person that you gave these images to pretty much blindfolded. Yeah. The reason why they said, wow, these kidneys have grown is because and you gave them with no years, right?
Right, exactly.
So the entire notion is you get two set of images, you see that there's a big change, you automatically assume it's the growing, you don't ever assume it's a decline, right?
Right, because she did know that it was a PKD patient, right? So
yep.
That was the assumption. It was like, oh my gosh, they have really grown from one year to the next. Like, well, they haven't. It was actually the opposite, which was super cool because she messaged me that, and I looked at the data sets, and I was like, okay, great, it matches with the AI-based tool, which was really encouraging to see. It's always good to double check your work, right? Especially with something that is so controversial, if you will. Like many people don't necessarily want to believe that this can be so effective yet. So it's always good to double check with multiple ways of measuring. Here we have two different measuring tools, right? Ultrasound and MRI. And then we also have two different analysis of the MRI images, one that was completely blinded, one that was done fully automated, where I have no hands in measuring anything. I just upload the images and it does it for you. There's nothing I can do to the data. So that was really, really exciting.
That's awesome. And it brought tears to my eyes actually hearing that, because that's not something that's supposed to happen with PKD.
Yeah, exactly. And we also, what the great thing that comes out of this automated tool is the what's called Mayo imaging classification. That's typically how they can determine, or where they try to predict what your progression might be, and it puts you in a certain class. So you were put into this class 1C, right? And then it's based on your height and your age, and it kind of projects where you might be going with this disease. And of course, the standard is you will never go back, right? If you're once in class C, you're never expected to maybe go to class D or class E, or maybe stay in class C, depending on your variant, but no one ever goes back, right? And in this case, you at this point haven't gone totally down to a new class, but your trajectory is lower, which indicates that you're actually on the reversal side of the disease. And I suspect, this is just a prediction, obviously we will have to wait, but if we wait another 2 or 3 years of you following this, you might actually end up being in that class B eventually, which would be obviously amazing. And I can't wait to see all your data in the future.
Me too.
And then also, of course, you are one of those cases who started this when you still had full kidney function. That's obviously a question that often is asked. Oh, but okay, your cysts are getting smaller, but what about your kidney function? Your kidney function was totally normal still when you started this, and you still have totally normal kidney function, so nothing has changed there. Nothing to groundbreaking here, but you maintained your full kidney function, which is a win in itself, right? And having so many cysts in your kidneys, and you still have full kidney function, and still after a year. And it also shows the intervention doesn't mess with your kidney function at all, which is not always what people say, right? Because it was a lot of red meat and protein, and that is something that is generally not recommended, but for you, it seems to have been totally fine.
Yep.
And Do you want to touch on your cholesterols and your...
Sure.
Yeah.
If you're looking at these, you're probably like wigging out a little bit. I discovered that I'm actually a very weird phenotype, not genetic, because genetic LDL is around FH, I believe it's called, where it's a genetically dangerous LDL. A lean mass hyper responder, you can type it on Google, YouTube. There's actually doctors who are a lean mass hyper responder, and they have done studies. If you ever find yourself in this situation, just take a deep breath, go ahead, do a lot of research, definitely work with your doctor as well. Provide your doctor this information. When you restrict carbs as a lean mass hyper responder, it pretty much triggers your LDL to go higher as a sense of fat mobilization. And a lot of it has to do with if you are a cardio buff like me, if your body composition is going to change, you lose fat in your midsection, you put on muscle mass. All of this plays a role. I ended up doing a coronary artery scan, which is very non-intense. Literally took longer setting it up than actually the images. No contrast or anything. You just lay back, go inside. It's not a MRI tube. It's just essentially a CAT scan, and then snap a few photos, and you get a calcium score. My calcium score is 0. So that is a clear indicator that my LDL, or it shows I'm a lean mass hyper responder. Not to mention my LDL on my sugar diet from back in 2023, January 23. My LDL was actually really low because I was eating pure sugar and I wasn't eating a lot of So it kind of really goes into the phenotype of a lean mass hyper responder. But this is one of the touchy subjects, and my mom, she ended up dropping over 40 pounds doing keto and carnivore. Her LDL was a little elevated. She's not a lean mass hyper responder, but she did get a CAT scan done, and it came back as 0. A lot of people get discouraged treating PKD because their LDL starts rising. If you're really scared, then ask your doctor for a CAT score. It's very easy to do. My insurance covered it, and a lot of people don't actually do that, and then they kind of stop doing this when it could be extremely beneficial for them.
Yeah, and also LDL is measured differently everywhere you go, and it doesn't usually tell you the full story. There's a whole rabbit hole about particle size and inflammation and what that means in relation to LDL. We don't need to go into it here today, but it is always good to get more information before going on a statin or quitting your ketogenic journey. LDL alone, a high LDL isn't the full story, and usually it really depends on the person what that really means. So I would encourage everyone to really deeply look into this topic because it's very misunderstood in the medical community, and it can really discourage people, like you were saying. I'm one of those who have been doing the ketogenic diet for now nearly 3 years, and my LDL never got high. I'm not a lean mass hyper responder. So those people also exist. To be fair, I never went 0 carbs, so maybe I will don't know what would happen then. But I would definitely encourage people to keep going and to be more educated around this topic before making any drastic decisions. That is kind of your story in a nutshell. The conclusion for this presentation, that I'm actually taking to a scientific conference soon, so I'm really excited. And thank you so much for letting me take it to the community and show you data. I really appreciate it. Our conclusion here is that likely for PKD, the environment and the triggers really, really matter. And by following a low carbohydrate diet and obviously stay hydrated, and by having a system with increased BHB levels through various methods, whatever that is for you, ketogenic diet, carnivore, fasting, exogenous ketones, all of them are probably going to be very helpful. And that will help reduce cyst growth, preserve your kidney function, and also just add to overall quality of life and your health, because all other kinds of symptoms from inflammation and anything else that a high sugar diet causes will also go away, which is something I have experienced. And I think your experience has been the same. So that is just an added bonus, even if, I always say, even if tomorrow someone told me I didn't have PKD anymore, I would still do this diet 100%.
Same. Yeah, but before I got my genetic test back a couple weeks ago, ironically, I was under the same notions too. Even if it does come back as something weird, I'm still going to continue this.
Yeah. Well, thank you so much for joining me here today, and most of all for sharing your data. It's not everyone is this open about their journey, and it really takes people like you to raise the awareness and really encourage people to do something about their PKD, because now there really is something you can do about your PKD. So I cannot tell you how much I appreciate all of your efforts and your dedication to this. It's really, really awesome. Thank you so much for being here.
Thank you so much once again for everything you do, and especially coming up with this treatment plan.
And for anyone who's watching this video, if you would like to get started on this type of journey and you don't know how, you're more than welcome to check us out at Ren-Nu.org. We have a fully up and running nutrition and lifestyle program for PKD patients that is teaching exactly these strategies. So come on over. We would love to have you. We have a wonderful community of patients that gets together every week, and we're figuring this out together. Either I see you there or I will see you in the next video. Thank you so much for watching, and have a good day.